Dr. Robert Murphy, he's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So do we have evidence in Illinois that traces COVID spread to restaurants?
Yes, and bars. Bars are worse. Restaurants, a little bit more than that. Any grouping of people, pretty much over 6 to 10 people, puts people at risk. And there's really no doubt about it. I mean, look at the numbers, not only in Illinois, but the entire country. It's worse now than ever. We have got to do something, and we have to do it together. The enemy here is the virus. It's not each other. We want this thing to end. Everybody wants the same thing. So we got to get all on the same page and stop all this bickering and let's get rid of this thing, like they've done in many other places, like in Taiwan.
What about the theory that, if people don't want to go to restaurants, they don't have to go, and a lot of these numbers are because of people having private gatherings at their homes?
That's true. That's true. Matter of fact, that's probably now the biggest place people are getting it.
And you can't go into people's homes and police what they're doing at their homes, so...
No, you can't. But you can give what you can give, Robin, is a clear message. I mean, it's got to come from every quarter that this just can't go on like this, at least for the time being, until the numbers go down. And they can go down, and they will go down.
And talk about statistics about hospitalizations that the government is not releasing. Why would that matter to the public?
Yeah, well, if you don't like what the pandemic is doing and what it's doing to the medical system, just don't release the data. That's the easiest way to kind of erase that. Well, obviously that doesn't work because every state, has those numbers as well, and they can just report it themselves. It makes it a little difficult to do some kind of national policy out of it. But states are running out of hospital beds. And it varies by state and by city. In the upper Midwest, in the Dakotas in particular, they're really very close to a crisis situation.
Talk about what they're doing in Taiwan, because their numbers are very good.
Yeah, they're very good. I think I never had really wanted to. I have visited Taiwan once, but I've never really, I don't really want to go there again, whatever. It was not my kind of place. But 23 million people, no COVID case in 200 days. Not one. They did everything right. We did everything wrong.
What did they do? Did they shut everything completely down for a long time?
They never did. They never had to. They were already wearing masks. They had a massive contact tracing. They had after the SARS epidemic in 2003, they set up this epidemic command center. They activated that immediately as soon as they saw the virus in China, before it even came to Taiwan.
Huh.
They just did everything ahead of time. And traced all the people that were infected. They really did it right. There's other countries that have done very similar. New Zealand has done very well. Hong Kong has done pretty well. Vietnam has done well, with very little money. Northeast part of Canada, the 4 Atlantic provinces, have, they made their own little travel bubble. You can go between those 4 provinces, but not the rest of Canada. Huh. I mean, it's amazing who's been successful and who hasn't. What is it that we can't get? All we have to do is do what these people are doing, and this thing will go away too.
All right, let's get to viewer questions. I work with several nursing homes in the Chicagoland area. We perform PCR tests weekly on all patients and staff. Often when a patient tests negative, they may go out to the hospital for procedure and the rapid test shows positive. And then when we PCR test them again, it's negative. Please advise on this discrepancy.
That's called a false positive test. And this is a problem with the rapid tests. It doesn't occur that often, but obviously it's happened with this patient. The standard test is the PCR test. It's the best test. If that test is negative and the rapid test is positive, there is a big problem with the rapid test. So that's a false positive test. Go by the PCR.
Okay.
All right. Next question. When a vaccine comes out, do you think there will be a high dose for 65 plus like the flu?
Well, this is another really good question. Nobody has the answer yet. We will see. When these vaccine studies come out, they're gonna show us how many people are protected from COVID. They're gonna show us what the antibody levels are in the blood, what the protection really is. And in older people, if it's like the flu, that level may be lower. So what are they going to do in older people? They're either going to increase the dose or they're going to give more doses. So, but that answer, we don't have it yet, but we will.
All right, Dr. Murphy, thanks for being with us. You can go to our Morning News Facebook page to post questions for the doctor. We'll talk to him again on Monday. Have a good weekend.
Thanks, doctor.
Have a great weekend. Happy Halloween.
Happy Halloween.
Hey, Paul.
Hi there. We're going to see sun